Anita Chacha is on a mission. She's a community health worker. She keeps tabs on the well-being of residents in her village, Bambalang, in northwest Cameroon. Today, she's visiting her neighbor, Priscia Ngui, who's pregnant with her fourth child. Anita wants to find out why Priscia's missed an important antenatal doctor's visit.
Madam Prisca, good afternoon. I don't come to ask you whether you will go to ANC clinic where I will give you referral form so you don't drop for ANC.
Yeah, I don't go.
You sure say you don't go?
Yes.
As Anita explains the importance of attending antenatal visits, she learns that Priscia missed the appointment because she didn't have enough money for a scheduled test. Anita points out that many services are now free or offered at a reduced price.
Like I say, for Friday, you go at ANC clinic. You don't miss again.
Anita is part of a countrywide effort to increase access to health services for women and children. Cameroon's northwest region has some of the worst health and poverty outcomes in the country. Since 2011, with financing from the government, IDA, the World Bank's Fund for the Poorest Countries, and others, Cameroon has been improving those outcomes with a program called Performance-Based Financing, or PBF, rewarding health facilities with cash based on their performance.
When we discharge patients, we disinfect the beds.
Sister Vera Ngalim is head nurse at St. John the Baptist Catholic Health Center in NDOP district.
We didn't have a good water source. We used to have electricity problems. Some of our patients did not have sheets on their beds, and the staffs, some of them used to complain about their pay and not being motivated. Now we have a well, and we're able to have water flowing in the health center always.
Performance-based financing has also benefited public hospitals in the same district.
What PBF have done for 4 years is just like a magic pill that has turned things around.
Since the start of PBF, the hospital has added 16 new staff members. They've bought mosquito nets, bed sheets, installed a new floor, and they've invested in solar energy for backup power.
Once we're operating and lights goes off, the solar panel takes off immediately.
The hospital's budget for pharmaceuticals has nearly quadrupled.
I took over 4.2 million, but we are now working at least 16 million for 3 years. We buy in great quantity, we share in two. What you have seen here like this is what my colleague is having the other way.
They've also been able to provide free services to their more vulnerable patients.
Cesarean section is free here. They only pay for their drugs.
Taking care of the poor and vulnerable, we never used to do that. But now, even in our budget, we plan and we take care of them.
The second child I gave birth here, but the price, when I paid the hospital bill, was not like that. So there is a reduction this time. Yes. When they do like that, we too will feel relief.
And then I check the patient if you make a won't start contract before time.
Patients are also now encouraged to give feedback on their healthcare experiences. Every quarter, former patients are asked about what they liked and disliked about a health center's service. The feedback affects a health center's overall score, which determines how much money they'll get. Since 2015, the Global Financing Facility has been building on this work, along with the government and partners, to make prioritized, results-focused investments in the health and well-being of women, children, and adolescents in the country.
And what GFF is, it's that concerted effort dedicated to women and children. And we haven't done that before. It's never been people-centered, it's been disease-centered.
You go give this one, and this one will be the one for delivery. It's really working because the community love it. They love it so much when you move around and advise them on health issues.
Aujourd'hui, le Cameroun a des priorités. La grande priorité, c'est la santé de la mère et de l'enfant. Et nous pensons que le GFF va nous permettre absolument non seulement de progresser vers la mise en place d'une couverture sanitaire universelle, mais surtout de prioriser toutes les interventions qui vont en direction de la femme et de l'enfant.